Okay, so let's do a recap on diastole and systole, and that will carry us into something called stroke volume. So remember that diastole is relaxation, that systole is contraction. So diastole, relaxation, systole is contraction. So while your ventricles are in diastole, your atria are in systole. So the ventricles are relaxed at the same time the atria are contracting. That makes perfect sense. As the atria are contracting, they're squeezing blood out of the atria into the ventricles. Those ventricles need to be relaxed to receive that blood from the superior chambers. What's going to happen is increasing pressures within the atria from the blood volume and the contraction. That increasing pressure is going to force those AV valves to open, so that right AV valve and that left AV valve are going to open, and the amount of blood in the ventricles at the end of ventricular diastole is called the end diastolic volume. So at the very end of ventricular relaxation, we have a volume of blood in those ventricles, and that's called end diastolic volume. Hang on to that term, end diastolic volume, for a little bit. Alternately, when we're in ventricular systole, we are also in atrial diastole. So as the atria are relaxed, the ventricles will contract. That's important because now I have an increasing blood pressure within the ventricles, and as that blood fills and the pressure increases in the ventricle, it forces those the right and the left AV valves, the tricuspid and the bicuspid valves, to close. Pressure will continue to increase, and when it does, those semilunar valves will open. The semilunar valve into the pulmonary trunk from the right ventricle and into the aorta from the left ventricle. We're going to eject that blood out of those ventricles, and the amount of blood that is left that remains in the left ventricle at the end of systole, at the end of contraction, is called the end systolic volume. By doing some very simple math, we're going to get something called stroke volume. Stroke volume is the total amount of blood that gets ejected from the left ventricle. It's a very simple math calculation. It's the end diastolic volume minus the end systolic volume. So the diastolic volume, how much was in the ventricle, minus the systolic volume, what's left after the contraction, and that's going to give us the amount that was volume. This is a nice little summary slide. It's an overview for what's happening in the valves during systole and diastole. So at this point in time, ventricular diastole, which is the same as atrial systole, the AV valves are open. Remember, these ventricles are relaxed, the atria are contracting, the AV valves are open to allow that blood flow, the semilunar valves or the outflow valves are closed. When we shift gears, and we have the early relaxation of the atria, and we have the contraction of the ventricles, what happens is the AV valves close, so we don't get backflow from the ventricles up into the atria, and then we have an opening of the semilunar or the outflow, those pulmonary and aortic valves. There is a point in time where we have a minor shift, and that's when we are at a point where we have ventricular diastole, so the ventricles are relaxed, and we have a very late atrial diastole, whereby both the atria and the ventricles are in a relaxed state. The AV valves are open and the semilunar valves are closed. That's going to correlate with your images down here. Please, if you're having any trouble with what the valves are doing, what systole and diastole mean, please send me an email, post a question, do something like that, catch me in office hours or whatever, and we'll talk it through. Relaxation period, you'll remember from our discussion about action potential, depolarization, maintained depolarization, repolarization, and then the relaxation period or the refractory period. So in this regard, what we're talking about is a time when both the atria and the ventricles are relaxed. And that was what we had right here. We have a late atrial diastole and a ventricular diastole. And this is called the relaxation period. And what happens is the pressure in the ventricles fall. It decreases, the semilunar valves will close, and we get something called isovolumetric relaxation. And basically, isovolumetric relaxation just means is that I have this brief time frame when all 4 valves are closed. All valves are quiescent, nobody is open. We've got passive filling into both of the atria. And what we're going to see during this period, which lasts only about 0.4 seconds, so not even half a second, what we're going to see is that ventricular pressure continues to decrease. AV valves are going to start to open as we fill in those atria, and then after that we'll see ventricular filling begin. As the heart beats faster and faster, say with exercise, what we're going to see is that the relaxation period, that time when both atria and ventricles are quiescent, decreases. It gets shorter. Interestingly enough, the duration of systole and diastole only shortens slightly. So really what the heart does is it decreases its relaxation period as the rate increases. It doesn't directly, or rather significantly, directly is incorrect, it doesn't significantly affect the duration of systole or diastole. Those stay pretty consistent, but what actually takes the hit is the relaxation period. So this next image, sorry about that, this next image is just a summation of all the things we've been talking about. What we're seeing on the ECG, how that would correspond to pressure monitoring, where that would fit with heart sounds, and then the volumes in the ventricles, and then again which valves are open and what's going. So all of these are color-coded as you move down. You can follow across what's happening. The average time required to complete a cardiac cycle, which is exactly what you're looking at from the start of P into QRS back into the middle of the R wave. So the average time for that is usually less than 1 second. It's about 0.8 seconds. And that gives us a heart rate of about 75 beats per minute. Of that 0.8 seconds, we've got about 0.1 second where we're going to see the atria contract, also called the atrial kick. Ventricles are going to be relaxed there. We're going to see 0.3 seconds where the atria relax and the ventricles contract. We're going to have about 0.4 seconds of relaxation period where all of the chambers are relaxed, and we're going to see passive filling. And just remember that as heart rate increases, the relaxation period is what gets decreased the most. We'll have a minor effect on systole and diastole, but predominantly what we'll see is a decrease in the relaxation period.